Vascular surgery, it's incredibly delicate work. Keeping everything flowing as it should needs amazing skill.
Absolutely. Precision is key.
But, beyond the actual surgery, there's this whole other layer, all the admin stuff.
Mm-hmm. Paperwork,
Mm.
insurance hassles, scheduling.
Right. And it feels like that can really pull surgeons away from, well, the patients.
Exactly. And that's what we're diving into today. How outsourcing some of these administrative tasks can actually transform things for vascular surgeons.
Okay.
Think about it. Verifying insurance, getting prior authorizations, which are crucial, then juggling appointments, handling the whole billing cycle.
Revenue cycle management, yeah.
That's the one. It's a significant amount of work, a real burden.
It sounds like it. And if you're trying to get your head around this whole area, hearing about all those tasks, well, it can seem overwhelming.
For sure.
So our aim here is to break it down, show you why this really matters in healthcare today.
And maybe ground it in a real story.
Let's do that. Imagine an 83-year-old patient. They've got stage 3 peripheral arterial occlusive disease, PAOD.
So serious narrowing of the arteries in the legs
Mm-hmm.
affects blood flow
And
significantly.
the specific problem, a blocked bypass graft in their leg, a previous surgical fix that's now failed. That's a tough starting point.
It really is. And, the medical complexity there often mirrors the administrative complexity.
How so?
Well, you need pre-approvals for specialized treatments, detailed insurance claims, coordinating multiple follow-ups. It all stacks up. It's a heavy administrative load tied to that one complex patient.
Oh, okay. Yeah, I can see that. So let's dig into the surgery side again. That intense focus needed.
Right. You're talking intricate bypasses,
Hmm.
revascularization procedures to restore blood flow, placing tiny things called stents.
Takes years of training, laser focus, like a high wire act almost.
It is. The concentration needed is immense. Surgeons are making decisions in real time that have huge impacts on someone's life, their mobility.
But then, running alongside that is all the admin. It's necessary. Obviously, the practice needs to run, get paid.
Of course.
But it pulls these highly skilled people and their teams away from that core mission. It's kind of like asking, I don't know, a star architect to also handle all the invoicing and permit filing personally.
That's a great analogy.
Mhm.
And that's really where outsourcing steps in. It's a strategic choice.
Delegating the non-clinical tasks.
Precisely. Handing them over to specialized companies that, frankly, live and breathe this stuff. They handle it efficiently, expertly.
Which lets the surgeons and their clinical staff get back to focusing on the patient.
Back to what matters most, delivering care.
Okay, so let's get specific. What kind of tasks are we actually talking about outsourcing?
Well, a really big one is prior authorization and insurance verification.
Right, getting the go-ahead from insurers before procedure.
Exactly. And in vascular surgery, many procedures, many devices are high cost. They need solid justification. Getting those approvals, it can be a real bottleneck.
Yeah.
It can cause treatment delays. And there are companies out there, Staffingly, Inc. is one example, that specialize just in this, navigating that whole complex insurance world.
And it's not just filling forms, is it? It's understanding policies, knowing what proof they need.
Absolutely. Advocating for the patient's care, essentially. Making the case.
So what's the benefit of outsourcing that part?
You see fewer delays in getting treatment started, fewer claims getting denied, which helps the practice's finances.
Smoother sailing financially.
Right. And maybe the biggest thing, it frees up the surgeon's time. More time with the patient, discussing options, planning the best care, not chasing paperwork.
Okay, that makes sense. What's another big area? You mentioned revenue cycle management, RCM.
Yes, RCM.
Right.
That's the whole process, start to finish, of getting paid for the services provided.
Sounds critical.
It is. And in a specialty like vascular surgery, getting the coding right for procedures, submitting claims correctly, it's vital. Errors here can really hurt reimbursement.
Affect the practice's bottom line.
Significantly. It can impact the practice's sustainability, honestly. So again, you have specialists like Staffingly, Inc. offering these RCM services. They handle the coding, the claim submissions, chasing payments, the whole 9 yards.
So it's about accuracy, efficiency,
Yeah.
making sure the practice gets paid fairly for the really complex work they do.
Exactly. Minimizing those errors that cause payment delays or denials.
And that reduces financial stress.
Definitely. Which means the practice might have more resources to, say, invest in new technology or more staff training. Ultimately, it cycles back to better patient care.
Okay. And then there's just the day-to-day logistics. right? Appointments, coordinating everything.
Oh, yeah. Managing schedules,
Yeah.
especially with complex surgeries. You might have multiple consults, the procedure itself, lots of
Sounds
follow-ups.
like a juggling act.
It can be. Scheduling clashes, patients missing appointments.
Hmm.
It adds to the administrative noise. Outsourcing this, maybe using virtual assistants, can really streamline things.
Yeah.
Make the practice run smoother day to day.
Like having a dedicated coordinator, making sure everyone's where they need to be when they need to be there.
Pretty much. So the clinical team isn't distracted by that. They're focused on the patient in front of them.
So if we zoom out a bit, what are the big picture advantages here for the surgeons?
Well, number one, less admin burden. Obvious, but huge. More time for clinical work.
Which surely means improved efficiency, more time with each patient, better focus, maybe better outcomes.
That's the logical connection, yes. Better focus often leads to better results. And it's not just time. There are often real cost savings.
Really? How much?
Estimates vary, of course, but some suggest outsourcing can save up to, say, 70% compared to having a large in-house admin team handle everything.
Wow, 70%. That's substantial. Money that could go back into the practice.
Exactly. New equipment, better facilities, investing in the team. Plus, minimizing errors in billing and insurance means faster approvals, fewer denials.
Better cash flow, less financial headache.
Right. And when you put all that together, less burden, more efficiency, cost savings, smoother finances, it all points towards better patient care.
How so?
Because the providers are more focused, they're less stressed by admin tasks. They can dedicate more mental energy to the patient. That generally leads to higher patient satisfaction and, you hope, better health outcomes.
Okay, let's loop back to our patient example. The 83-year-old with the blocked bypass sounds incredibly complex surgically even before you add the admin.
Oh, it absolutely was. The first step was a revision of that blocked bypass. They used something called an Omniflow prosthesis.
Omniflow, what's special about that?
It's pretty amazing, actually.
Yeah.
It's a biosynthetic graft that's initially developed in a living host, a sheep in this case. The idea is it encourages the patient's own endothelial cells to grow onto it.
Wow, like creating a more natural lining for the bypass.
Essentially, yes, aiming for better long-term success. Really cutting-edge stuff.
Okay, so they use this advanced tech, but you said more treatment was needed.
Unfortunately, yes. Even with the new bypass, the blockage issues persisted, so they had to go back in. This time for revascularization of the superficial femoral artery, another key artery in the leg.
Just highlights how challenging this disease can be.
It really does. Advanced peripheral artery disease is tough.
And they used stents this time, you mentioned. 2 different kinds.
That's right. To help keep that artery open, they use stents. One was the Super Stent from Abbott. It's made of nitinol.
Nitinol. That's a nickel titanium alloy, right? Shape memory.
Exactly. Known for being very flexible, but also strong, durable. Really important in leg arteries that bend and twist with movement.
Makes sense. And the other stent.
That was the Epic Stent from Boston Scientific. It's often used for slightly larger vessels and has a design specifically to resist collapsing or narrowing again after placement, what we call recoil.
So a tailored approach, using specific tools for specific challenges within the same artery.
Precisely. Matching the device properties to the vessel's needs.
And what was the outcome for the patient?
Thankfully, it was successful. They managed to restore good outflow, good blood flow through 2 vessels down in the lower leg.
That's great news. A major success in saving the limb, presumably.
A very significant achievement, yes. Preventing much more serious complications down the line.
Okay, now think about that whole case. The initial complex bypass revision with the Omniflow, then the second procedure, the specialized nitinol stent, the anti-recoil stent. Can you just imagine the administrative trail for all of that, getting prior authorization for those specific high-tech stents?
Oh, absolutely.
The detailed billing codes needed for multiple complex procedures on an elderly patient, coordinating all the appointments, the follow-ups.
It would be immense, truly substantial. Without a specialized admin support system, whether in-house or outsourced, the surgeon and their immediate team would be spending so much time on that.
Time taken away from
planning the surgery, from performing the surgery, from the patient's direct clinical care. Time better spent ensuring the absolute best surgical outcome for that patient.
So it really crystallizes the point, doesn't it?
I think so.
The core message seems pretty clear. Let surgeons be surgeons. Offload these vital but time-consuming admin tasks to specialists.
Right. Let them focus on their core expertise, saving limbs, saving lives, improving patient well-being.
And this shift isn't just good for the surgeons or the practice finances.
No, it ultimately circles back to better, more focused patient care and potentially a more efficient healthcare system overall.
It really makes you think,
Yeah.
when you remove those administrative roadblocks, what potential is unlocked, allowing these incredibly skilled professionals to just focus. Think about other complex fields, not just medicine. Where else could this kind of specialized outsourcing lead to breakthroughs, to better results, simply by enabling deeper focus on the core mission? Definitely something to ponder.